So let's continue. We're talking about cholinergic agents, and that basically means agents or drugs that's used to help with the parasympathetic system. Drugs that help someone relax, that help someone decrease their heart rate, that help someone digest. Okay, so when someone is relaxing, if we remember from earlier, when someone is in a rest and digest state, if they're happy and relaxed, what happens is their saliva starts to secrete more. Their heart rate starts to decrease, so they're more calm. So the heart doesn't need to pump as much, and the food is able to digest. And also, if they need to do number one or number two, they can so easily. They can't do that in the other fight and flight. Okay, so stimulates urination as well. So what happens when you take drugs? When you take cholinergic drugs, well, you're going to get a decrease in heart rate because see, she's relaxed, so her heart rate's decrease. And when you're relaxed, digestion will happen, right? So the GI tract or the small intestine or the large intestine, it can work to pass your food along properly and digest it. Now, sometimes we'll always have adverse reactions to medication. And the way to remember the adverse reaction for cholinergic agents is SLUT. So people who are relaxed, and if they take this drug or a drug from this family, some side effects is they could have excess drool, their ears could get extremely watery, they find themselves going to the washroom after either for number one or number two. So those are some side effects with these type of drugs. Because remember, what this drug does is it stimulates all these. So who should we not give these drugs to? Who should not be prescribed these drugs? So someone who has asthma. So let's think about it. When you are relaxed, what happens? So when you're relaxed, your lungs don't open up. Okay, think about the opposite actually. So let's say you're running so hard, you're running from a bear. When you're running from a bear, the lungs open up so that you are able to breathe better, so that oxygen can flow better. But when you're relaxed, when you're taking a drug so that you can be in this state, your lungs will not open up. Your lungs will constrict, will close down a little bit because you don't need that much air. You're not huffing and puffing. So people who have asthma, if they take this drug, what will happen is it'll become worse for them. So when someone has asthma, what happens is it's hard for them to breathe because they don't have enough oxygen, right, in their lungs. So if you give them this drug and they're in a relaxed stage, it's just going to make it even more harder for them to breathe because what happens with the lungs, it starts to close up. So as people who have asthma will struggle even more to breathe. So you don't want to give this drug, the cholinergic agent or cholinergic drug, to someone who has asthma, because if you do, their lung will constrict even more. They won't be able to breathe as much. Same thing with severe cardiac disease. If someone has severe cardiac disease, we do not want to give them the cholinergic agent because if we give them this drug, what will happen is their heart will get slowed down even more. So blood won't pump through their heart. And we don't want to slow down their heart. Rather, we want their heart to be working effectively and be pumping blood, right? So we don't want to slow someone's heart down, especially if they have cardiac disease. So when we're looking at dental hygiene considerations, anytime where someone is given this drug or a drug in this family, be mindful of xerostomia, because what can happen is sometimes some drugs have an effect like dry mouth, and we're going to learn later on what to do when someone has dry mouth. If someone does have dry mouth, one of the drugs that's prescribed that falls under this category is pilocarpine. And here it's 2 milligrams. In the textbook, it says 5 milligrams. So anywhere in that range is what they're given, what the clients are given. And it's hoped that when they take this medication, they get more saliva. So Now we're going to look at anticholinergic agents. And that basically means, so anti kind of means not parasympathetic agents. So in other words, agents or drugs that will not make you relax. Okay, so agents or drugs that do not make you relax. And the way it works is, if you remember this over here, so if I have a signal, my brain is giving me a signal, the signal is going through here, neurotransmitters are being released, it goes through the postganglionic neuron, neurotransmitters again are being released, and then your heart can start pumping, for example, pumping fast or pumping slow. Well, what happens when you take this drug is that it blocks this neurotransmitter. So the signal will not pass through. There is no neurotransmitter released here. And when it blocks this neurotransmitter, the signal can't go through the heart, for example, because it blocks it. So a drug that falls under this category, basically what it does is it prevents ACH, prevents acetylcholine from pumping out and bonding to a receptor, which thus means that the effector organ or the heart will not work as effectively. So let's look at some examples. So if I take a drug that falls under this category, it basically means that I am avoiding a resting phase. And if I'm avoiding a resting phase, what can happen is that I will have a dry mouth. Just think about it. If you're in a resting phase, we get more saliva. Remember I said that example, if you're resting, if you're sleeping, we may drool on the side because we get more saliva. But when you're not resting, you'll have the opposite effect, which is dry mouth. When you're not resting, digestion will not be happening. It will stop digestion. And when someone stops digestion, what happens is you get constipation because the digestive system is not working. So when you're resting, the digestive system is working. When you're taking this drug here, when you're not resting, okay, so when you're not resting, the digestive system is not working. And when the digestive system is not working, everything will build up over here and we can get constipated. Again, when you're not resting, your eyes can get dilated, right? So think about it. When you're resting, your eyes are relaxed. But when you're not resting, your eyes are wide open, and sometimes you can have bloodshot, wide open eye. So again, anticholinergic agents are drugs that are used to avoid you from resting or to avoid you from getting into that resting state. And when you do that, when you take those drugs, what will happen to the heart? The heart will beat faster. Because if you're in this state, if you're resting, your heart beats slower. But when you're not resting, your heart is going to beat faster. So this type of medication will make your heart beat faster. It will do the opposite of what your resting state does. So anytime we take drugs, there are always side effects. There's always adverse reactions that could happen. Xerostomia, dry mouth, heart beats faster, or constipation, or someone who can't even go to the bathroom to pass number 1. So again, let's try to understand this. If you're taking an anticholinergic drug, that means you're taking a drug that prevents you from resting. When you are not resting, you're going to have dry mouth. When you are not resting, your heart could start to beat faster because when you're resting, your heart beats normal or slow. But when you're not resting, your heart could be beating faster. When you're not resting, the digestive system stops working. And when the digestive system stops working, we may get constipation, and also we may have trouble going even for number 1. Okay. Something to keep in mind is if you are taking a drug to prevent you from the resting state, you want to be mindful of not taking antidepressants with it. You want to be mindful of not taking an allergy pill with it, because if you combine those 2 drugs, it could be very toxic and harmful for your body. So let's talk about this. We're going to see lots and lots of clients who have dry mouth. And dry mouth is bad. And the reason why dry mouth is bad is because people who have dry mouth, they have or they could have a lot more cavities than someone who doesn't have dry mouth. Saliva is so good to have in your mouth because it washes away all the bacteria, or tries to. It washes away all the plaque, or tries to, any sugar bugs, right? It'll try to wash it all off. I'll try to brush it all off. But when someone has no saliva or very little saliva, when someone has a dry mouth, xerostomia, then we have to be more mindful. So we would recommend them to come regularly for cleaning so that we could clean the teeth really well to prevent cavities from happening, to prevent periodontal disease from happening. We want them to drink lots of water to wash everything off. We want them to avoid anything with alcohol because alcohol dries up the mouth even more. So we want to avoid alcohol. We want to limit sugar containing drinks because if they have sugar, there's a higher chance of them getting cavities. And if you combine sugar with a dry mouth, that's not a good combination because now that person's at a really high risk of getting cavities. If the person wanted to have gum or candy, then sugarless gum or candy is the way to go. If you have someone who's taking those drugs, if you have someone who is taking an anticholinergic drug, you want to make sure that if they have tachycardia, make sure you check their pulse and BP all the time. In fact, anytime someone is taking that drug, we're supposed to always monitor their BP and pulse in the event that their heart is beating too fast. We don't want a medical emergency to happen in our chair, so we want to take precaution by taking their pulse and BP, making sure it's within normal limit before we go ahead and proceed. So this is the sympathetic nervous system, and when you're looking at the sympathetic nervous system, the way it works is the signal, okay, so goes through the preganglionic neuron, neurotransmitters are released, the signal then goes to the postganglionic neuron, more neurotransmitters are released, and then the heart can start pumping, for example. So the sympathetic autonomic nervous system is when someone is in a fight or flight state. Right? So that means that this person is running away from something. Their heart is pumping really fast. Their mouth has dried up. The digestion has stopped. Now, when you have a sympathetic nervous system, it's different than the parasympathetic autonomic nervous system because in the parasympathetic autonomic nervous system, we had ACH neurotransmitters here. We also had ACH neurotransmitters here. However, in the sympathetic nervous system, we have ACH neurotransmitters here, but we have different neurotransmitters here. Here we have NE, which stands for norepinephrine transmitters, and sometimes we can get epinephrine neurotransmitters. So the signals to affect the organ is different here. Also, when you look at the receptors, the receptor is where the neurotransmitters bind to. So it has to bind to this receptor for the heart, for the veins to work. It has to bind to this receptor for the heart to work. It has to bind to this receptor for the lungs to work. So this area right over here, I'm going to zoom in and show you over here. So this is the postganglionic neuron. Postganglionic neuron, the signal is going through this way. Once it reaches over here, all the neurotransmitters are being released. The neurotransmitters then have to bind to the receptor or bind to something, and once it binds to this something, which is called a receptor, now the veins will start working. Now the heart will start pumping. Now the lungs will start opening up. The way to look at it is if the neurotransmitter goes over here, and let's call this receptor alpha 1. So if the neurotransmitter binds over here to alpha 1, it will help with the veins. If a neurotransmitter binds over here, and this is beta 1, so if a neurotransmitter goes here, it will trigger the heart. It will get the heart to get moving a lot more faster. If the neurotransmitter goes in this third hole or third receptor, and this is beta 2, then, so beta 2 affects the lungs. Then the lungs will start opening up to allow more oxygen to go through. So it all depends where the neurotransmitter binds to so that the veins can get. So if it's alpha, 1, the veins will get affected. If it binds to beta 1, the heart will get affected. If the neurotransmitter binds to beta 2, the lungs will get affected, or the lungs will open up so that we can get more oxygen. So think about what happens when you're using a drug for the sympathetic nervous system. So when we say sympathetic nervous system drugs, the short way of saying that is the adrenergic agents. Adrenergic agents kind of means drugs for the sympathetic system, or drugs that help you get to the fight or flight state. And when you're in this state, you're obviously more alert. You could be anxious because a bear is chasing you. You could be worried that you could die. You get restless, and sometimes you may even have tremors. Your whole body starts shaking because you're so scared. So anytime you're taking a drug to stimulate this response, to stimulate the fight and flight response, what do you think is going to happen to the heart? This boy's heart will be pumping fast, right? So you would increase, your heart rate would increase, the contractions in your heart would increase. Your eyes will dilate like crazy. Okay, a fancy word for pupil dilation is mydriasis. What do you think will happen to the airway, to your lungs? Your lungs will open up. So if your lungs are closed like this, now you have open up muscles inside your lungs so that the oxygen can go through. People with asthma are prescribed an adrenergic agent, or a drug that helps with the sympathetic system so that the airways can open up in order for them to breathe. If you're in this state, you're going to have a dry mouth. So whenever you're taking a drug to stimulate this response, to stimulate the fight and flight response, you want to make sure that your clients who have high blood pressure are not taking this. Because think about it, if your client's heart was pumping really, really fast, and then you give them this drug, now their heart's going to pump even more faster, because high blood pressure and being in this state does not go well. If someone has chest pain and then you give them a drug that makes them even more frantic, that's not going to go well. So there are contraindications to these type of drugs. We don't want people with high blood pressure, people with chest pain, people with hyperthyroidism to be taking these drugs, because it's just make it worse. So in dentistry, we use these type of drugs, and one of the main drugs we use is epinephrine. Epinephrine falls under the sympathetic system drugs. How does epinephrine work? So here's an example of local anesthetic. So this is like an injection that someone is getting that has epinephrine. So you can see here it has epinephrine and lidocaine. Lidocaine helps numb the area. Epinephrine, what the function of epinephrine is to keep it in the blood, or keep the this local anesthetic in the blood for a longer period of time. So that means that you stay numb for a longer period of time. If you take a local anesthetic without epinephrine, the local anesthetic would go in and it would just flush right out. But if you take one with epinephrine, the local anesthetic will stay here for a long period of time. And the reason why it stays there is because the blood vessel has constricted. You see that? Here the blood vessel is open. Here, or dilated, here the blood vessel has constricted, has closed. And when the blood vessel closes, well, now the local anesthetic solution can stay there for longer. So you would feel numb for a longer period of time. Another reason why someone would take a adrenergic agent or a drug to make them feel, or activate their fight and flight response is if they have heart problems. So if their heart is shut down, we're going to make their heart pump faster. And to make their heart pump faster, we're going to give them a drug to make them look like this, to make their heart pump faster. If their airways are closed up, we're going to give them a drug in this category to help them breathe better. Because think about it, if he's running from his life, he needs air, he needs oxygen to breathe. So if we give them a drug to make them look like this, they will be able to breathe better. Lastly, to conclude, these are some drugs that fall under the adrenergic agent that help you become like this. And notice that they all usually end in RINE, right? So they're all from the same category, most of them. So epinephrine is the most common one that we use in dentistry.